Hi, I'm Thorben, Chief Business Development Officer at Lifebit. We're here in Basel, in the middle of the conference center, on day 3 of Biotech X. And with me is Claire from the NHS.
Thanks, Thorben. So I'm Dr Claire Bloomfield. I'm the SRO and Deputy Director within the NHS Transformation Directorate, and I lead the Data for R&D program.
What's the Data for R&D program in a nutshell?
So our vision is that by 2025 we will have a world-leading NHS-wide health data infrastructure that can enhance patient care, sustain the NHS and drive an expansion in the range and variety of innovation underway in the UK.
What are some of the biggest hurdles in that, or the biggest challenges?
It's a very complex field, as you know well. There are layers of complexity. We have a real journey to go on in terms of public and patient trust and support for the uses of health data research for innovation. We have a big way to go in terms of giving innovators and academics the right kind of resources and services that bring a good user experience. But there are huge opportunities rather than challenges. Tech is moving forward substantially. We've got a unique position in the UK with our longitudinal healthcare record. So the time is right, and we're bringing together all of the relevant stakeholders to really have a shift in the way that we support data access and data uses in the UK.
You mentioned trust, and obviously there we're talking about millions and millions of people across the land. What is the key thing you're doing to ensure the public's trust into such a data program? Actually, research will happen over that data.
So one of the things I was talking about today, and we're testing it so we're open to feedback, is our concept of a data museum. So how are we shifting from data sharing and distribution to bringing people to the data and providing a consistent experience for people to come in, they pay their ticket price, they can interact with the data, they can undertake their analyses, but they're not taking the artifacts away with them. And that's partly to give the public an enhanced sense of trust and transparency about who is using my data, what are the insights they're generating, what is the impact of that in a consistent way up and down the length and breadth of the country. And as you said, we're looking at a 55 million patient-based population. It's never been attempted at that scale before, so we're looking at a federated network of museums. This isn't one monolithic activity. We need to do this across the country, not only for NHS data, but also with other data museums, locally, regionally, nationally, and internationally.
And exactly, that the federation of different museums, it feels like Exhibition Road in London, you know, maybe one pass to get to all of them. That international component plays a huge role. We had Chris Lund here from All of Us, and we're in Basel, obviously. Many global programs are here. What is your view on the NHS of that kind of international collaboration, both with other cohorts as well as with industry? What's the role of industry in this?
So there's two components, I think. One, we've obviously seen during the pandemic the huge role of international collaboration and the ability to link and share data sets across the globe to resolve issues and generate solutions very rapidly. The balance is now, how do we provide the right rigor and structures around that to do that across cancer, cardiovascular disease, mental health, and really where it's appropriate bringing people to the data museums, but where there is patient consent, ensuring that that data can flow nationally and internationally to generate the right international cohorts. So for where we're bringing people to the data, federation, linkage, inter-museum loans of artifacts, but where it's appropriate, still allowing movement and flow of data. So we're not intending for this to stop innovation, but actually to enhance the volume and variety of innovation that's possible.
Your talk was named or titled Data Saves Lives, right? And I believe that without industry, without pharmaceutical companies, it's really hard for data to save lives because it doesn't make it to the bedside, right? Those therapeutics. What are some of the key areas you think the program will focus on first, and what kind of research to enable what kind of research, what kind of area of therapeutics, diagnostics, what's the priority?
So this health data science is a team sport. We need industry, academia, the NHS workforce. We need patients and the public involved in that work as well. Within that then, we have a core number of life sciences vision missions around cancer, cardiovascular disease, but these are key priorities where there is an unmet clinical need or an NHS demand. We want to ensure that they support, and those are clear driver projects we can progress. We're working with GEL, we're working with the National Pathology Imaging Consortium, a range of modality and disease-specific activities, but really these infrastructures need to support AI, machine learning, epidemiological studies, the full gamut. So we're open for business, we want to be actively collaborating, and these solutions need to meet diverse types of industry and academic uses. But there are, as I say, I'd point to the Data Saves Lives strategy and the Life Sciences vision for the UK as where we're really pushing to align the data investments to support the priorities for the life sciences industry.
That is wonderful. I don't think I have much more to add to that. That's a perfect summary of a beautiful talk we had in a full room. So thank you so much for taking the time to speak with us today. Thank you, Claire.